what kind of sign and symptoms are really at the basic scale, because understanding these one really help you to see if anyone, unfortunately, is getting into that infection stage. One of the things that has recently really triggered so much onto the media is that the initial sign appeared to be taste and smell lost. So some people who are very sensitive, and they can feel that they can't taste or smell any longer, and that is probably the first sign. And soon after, it start to go a little bit of fever, dry cough. That is very common with the coronavirus compared to flu, where there is a lot more productive cough. Shortness of breath is the next stage. Fatigue, muscle pain that start to appear. And in the terminal stages is really the respiratory distress. That is the time when the virus go deep into the lung and where it start replicating and sort of causing the damage to the functional part of the lung. And when it reached to this stage, then there is a need for ventilator. That is the time when artificial support is required. And there are two different kinds of this ventilators spore. One is the non-invasive spore, where it does not require intubation. So just putting mask onto the supply of the oxygen onto the face, and then it required intubation. So major emphasis of the healthcare system is really at that stage, because these are those patients, those are at a critical stage, and these are the ones who require a specialized personalized treatment, which is a major burden for the healthcare system. So since ventilators in normal circumstances are not required at that level, this is a respiratory disease. So the scale of the intensity is really high, and the demand for the ventilator is really high, is because every person who get into the critical stage, one way or other, they require the ventilator support.